How is swayback posture defined? Swayback posture is a type of postural misalignment. If the lumbar spine curves excessively inwards or towards the front, it can cause the hips to tilt forward, and it causes the stomach to protrude forward and the buttocks to protrude backwards excessively. This tends to what people call swayback appearance. The medical term for swayback is something called hyperlordosis or excessive lordosis. Now, lordosis is a normal finding in the body, and we normally have lordosis in the cervical spine and in the lumbar spine. And there's a normal range for lordosis in the cervical and lumbar spine. And in the cervical spine, we're looking between 20 and 40 degrees of lordosis. And in the lumbar spine, we're looking somewhere between 40 and the higher end 50 or 60 degrees, but 40 is the ideal number in the lumbar spine. Lordosis refers to the type of spinal curvature that bends to the front, and that is normal. You should have a lordosis in the neck and the low back. The opposite type of curvature is a kyphosis that bends towards the back of the body, and this occurs in the thoracic spine or the mid-back. When the lordotic curve becomes excessive, this can be diagnosed as a hyperlordosis. However, some doctors may just say you have lordosis. They may not use the word hyper. Lordosis or hyperlordosis can be caused from many different things: poor posture, obesity, underlying neuromuscular conditions, spinal fractures, spinal misalignments. It can be associated with scoliosis, other areas of problems occurring in the spine like kyphosis in the thoracic spine. So when we see somebody with swayback position, we have to be concerned and looking for maybe some other spinal misalignments or some other concerns that could be more serious than just the way they're standing. Some of the most common symptoms associated with an excessive cervical lordosis could be something as simple as neck pain, but it could be shoulder pain because as the head goes forward, it becomes excessive curvature. The muscles in the shoulders have to work harder. It could be significant postural changes, tight muscles in the neck, like I mentioned, because those neck muscles are working harder, muscle spasm, headaches, muscle weakness. It can also be pain that extends down into the arms because once you start affecting the cervical spine, you can start affecting the nerves that exit to the cervical spine. And now when you start affecting the neurology, the symptoms can be very widespread. Common symptoms associated with excessive lumbar lordosis is that swayback appearance that we mentioned, where the abdomen protrudes forward and the buttocks goes backwards. Now, this is a very common appearance that we see when people have low back pain. They could have tingling or numbness into the lower body due to the compression of the nerve tissue. It can be low back and lower body weaknesses, muscle spasm, mobility issues. One thing that's very common is when patients try to lay on their back and their low back doesn't actually hit the floor. They can't push their low back into the floor because they have that excessive curvature. And in severe issues, it can start affecting functions of different organs like bladder control, muscles, and tissues. Now, normally when we look at swayback, we have to try to figure out what's causing it. So we want to treat it, we have to deal with the cause. And normally treatment plans are customized based upon the severity, experienced symptoms, and of course the causation. The underlying causation of the lordosis is normally the number one thing. Now, these tends to be associated with more severe conditions, things like scoliosis. It's a very common finding that we see with patients that have lumbar scoliosis or a thoracic scoliosis. The first appearance tends to be this swayback appearance. And then as the swayback gets worse, the scoliosis also worsens, and these two things worsen together. So therefore, when we look at somebody with a swayback, we have to examine the entire spine. You can't just look at the low back. If that tends to be the cause, then you have to deal with the causation that's associated with it. Now, some other patients may not require any type of treatment, but however, others may benefit from therapy, chiropractic care, muscle exercises to improve the stability of the spine, help improve the alignment of the spine. Postural remodeling of the spine can also help in terms of trying to realign the spine better, back into a better position. There's also some patients are just predisposed to this position as a result of how their pelvis formed as a child. Their pelvis formed more into this extension position, and as their pelvis gets more into extension, it can potentially lead to this swayback appearance. Now, in severe cases or cases that are left untreated, they may require surgical intervention or some type of spinal surgery, and this is something that could be very risky. So therefore, we normally want to try to treat these conditions using conservative care. Now here at the center, our first step with any spinal condition is to really determine the underlying cause. And in Swayback, we know it can affect the spine. It can be associated with other problems. So therefore, we look at the surrounding areas, we look at the entire body, and we try to figure out what's causing the body to become so misaligned and try to work on improving that alignment. Thanks for watching. I hope you found this information helpful. If you have any questions about this topic or other scoliosis questions, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish new videos just like this.